Welcome to the second podcast from RCPCH Us. I'm Luana and I'm a volunteer with the Podcasters Project. This episode is all about climate change with an international guest. It really shows how we like to collaborate and bring in all of our experiences to support our work and understanding.
Thanks, Luana. Hello, my name is Kirsten and I'm from the Climate Changers Project. Our guests this time are RCPCH Conference attendees, young people from RCPCH Us, a youth project in Ghana, and members of the RCPCH Climate Change Working Group, plus some tips. To start with, over to one of the RCPCH Us podcasters.
Hi, my name is Shreya. Today I'm going to be reading an original poem about climate change for you. We choke on pollutants, we gasp for every breath. The dust and smoke obstruct our lungs and swarm our vision. Yet for some reason we keep our chins up and we look away. Our allergies become worse, we sneeze and cough. Hay fever season leaves the summer. We religiously swallow antihistamines for months of the year, hoping it will have some tiny effect relieve some of our symptoms. And instead of action, we keep our chins up and we look away. The weather becomes more extreme. We change our jeans for shorts and jumpers for snow coats. We turn up the heating in winter and open all the windows in summer. We sweat and faint and chug glasses of water. We pretend everything is fine and we keep our chins up and we look away. We see the forests burning, the trees collapsing. We watch as the glows from the fires light up the night sky. We see it fight with the stars and the moon for dominance. And instead of cycling or walking, we sit in our cars and we keep our chins up and we look away. And once, just once, I look and stare. I sit frozen, incredulous, marvelling at the way we somehow managed to destroy this planet. And I silently hope that we can undo it.
Thanks, Shreya. That was a really powerful poem that really made everyone think. I'm Noor from the Climate Changers Project. We were really lucky as part of this episode to get to speak with one young person and two workers from the Ghana Youth Environment Movement about their project on climate change. Have a listen to our first ever international interview.
So my name is Perk. I'm the freelance graphic designer by profession and also work with the Ghana Youth Environmental Movement, where I serve as the national coordinator for the movement. I got into the climate movement because I want to leave a better future or legacy for my children and their generation to come.
My name is Gloria and I'm working as programs officer. I joined the environmental space to contribute my quota in protecting nature.
My name is Anokyewaa and I am from GEM, Ghana Youth Environmental Movement. I am honored to be here as well to talk about climate change affecting health.
So hello, I'm Joseph, I'm 15. I live in London and I'm interested in climate change because, well, I'm going to grow up and this is the world I'm going to be living in and hopefully it's going to be a good place to be. What do you think are some of the environmental changes you've seen in your sort of local area?
Now, usually when it's the evenings around 5, immediately it begins to get dusk. You begin to see a lot of mosquitoes hovering around that. You can't even get to spend 30 minutes outside just enjoying the cool breeze that the evening has to offer due to the amount of mosquito insects that you find around. You also wouldn't want to risk it because you are also exposed or prone to malaria, which you do not want to. And also, I'm beginning to see a lot of rodents like rats in my community, which 5-10 years ago, as a child and a young person, I never get to see.
Especially coming from an agricultural background, is the change in the weather condition, in the sense that now we cannot even predict when it will rain. It just rains at very random moments. When there's supposed to be Harmattan, we have rain. When there's supposed to be, rain, we have Harmattan and all of that. So that is a major change that I've seen regarding my climate here.
The Ghana Meteorological Agency just informed Ghanaians about the changes in the air in Accra. There has been a lot of dust, fog, and all that. So we are being informed to put on nose masks. We are being informed to get air purifiers. And so this has been one of the climate changes recently here in Ghana.
So what kind of things do your organisation do, and like what was the background behind it?
For Ghana Youth Environmental Movement, it's a youth-led environmental organisation where it advocates on environmental challenges, address global climate changes, and it is a group mainly for the young ones because we are the ones who suffer most from the negative impacts of these climate changes. And so we come together as youth from diverse backgrounds, and we try to contribute our quota to prevent some of these dangers associated with the climate changes and also protect ourselves and our country.
Our strategic focus areas are on climate, nature, and food, and that contributes to the promotion and also to the safeguarding of our natural forest, also contributing to climate and also addressing the issue of even food health.
So as an organization, during the outbreak of COVID-19 pandemic, we developed a post-COVID strategy, which stands on three main pillars. That is to empower grassroots activists, that's our first pillar. And secondly, to co-develop community-based resilience projects. And then the third one is to build strategic alliances to address environmental challenges. And under these three pillars, we've actually developed initiatives, the Ghana Young Environmentalist Project, which actually brought together over 200 young grassroots activists from the 16th region of Ghana to empower them with tools to address environmental challenges in their respective regions. We also have a project which is under the co-developed community-based resilience project. We have the Chain Soup project. It's a water kiosk project that was established or constructed for a community facing severe water poverty issue. And this project is currently dispensing water to over 700 households in the Treba community, which is a low-income community in Accra, Ghana.
Thanks so much for that. That was such a detailed answer. So on to the next one. You've talked a little bit about it already, but why is it important to protect the environment in Ghana and actually make a change?
So as a youth, if we do not protect this environment, in the next 5 to 10 years, 20 years, we are the ones going to suffer. And it is the duty of every citizen, everyone, to protect the environment in any way they can.
What three things do you think your young people would want other people to know about?
So I would want them to know about the struggles and sacrifices young people of today's generation are making to safeguard their own future. Young people are going through a whole lot of stress, figuring out their education, academic, figuring out job life, figuring out love life, family, and having to also carry the burden of protecting and fighting for the safety of their environment. And that is very overwhelming for young people of today.
But then I want young people all across the world to know that we are actually the people the world has been waiting for. It is our mandate to change this situation. We can only make it better and relieve the next generation of that stress as well. It's unfortunate we have to meet this, but then it is also an opportunity for us to do something to address this so that the next generation will celebrate our efforts.
To other young people, we have to be the change we want and the change we desire to see. And so we are the ones who are facing the consequences. And in order not for the other generation to also suffer from this, we have to work against these consequences we will have in the future and are having now. We have to start something. We want change, and so it starts with us so we can have a better environment.
I just want to say thank you so much for all of your answers. They were really, really informative, and they've given, I think, everyone an insight as to what is going on at different points in the world. So yeah, thank you for coming and chatting to us.
You're welcome.
Yeah, thank you for having us.
Thank you.
Hi, I'm Shreya from the Podcasters Project. It was really good to hear that interview. We all felt really inspired by the conversation with GYEM, and we hope to be keeping in touch with them over the coming months. Noor and Kirsten are going to let you know a bit more about the RCPCH Us Climate Changers project. Over to you, Noor.
Hi, I'm Noor, and I joined the Climate Change group last year. In terms of what we have done, we could sum it up in 2 words: awareness and insight. Firstly, we wrote an article in the RCPCH Us Milestones magazine titled Heal Our Patients and Our Planet, where we discussed our climate change project aim, the importance of the climate crisis, and what we hope to do within the project, which is collecting the voice of children and young people across the UK to find out what is important to them. We were also involved in a number of conferences where we were able to present the work we've done over the past year and listen to paediatricians talk about their experience with the climate crisis in clinics. For example, in the June conference, we had talks about inhalers and the impact of the NHS on the planet. Another key thing we were involved in was our RCPCH Us podcast, where we interviewed numerous doctors from conference, asking them reflective questions. This increased our knowledge about the matter and gave us strong insight into the impact of climate change from the viewpoint of a healthcare professional. I'm now going to hand over to Kirsten to talk about what we are doing now.
Hello, my name is Kirsten and I'm from Leeds. I joined the Climate Change Working Group because I want to be part of a group of young people learning about how to support young people with health issues related to climate change. We've been doing a roadshow to gather information and talk to young people about their thoughts and feelings on climate change. This brought up so many great responses, and I'm going to summarise a few of the key themes for you now. Young people, even primary school aged, are very aware of the negative impacts climate change is having globally, seeing the more frequent news stories on the devastating consequences of extreme weather, and this is really worrying them. Even more anxiety is being generated from what young people are experiencing firsthand, how this is affecting both their mental and physical health, such as asthma symptoms worsening, worries of being unprepared, and little things like no grass in the parks, meaning there was no escape to nature for some individuals. We learned that whilst young people are aware of these problems that climate change is having, the same cannot be said for solutions. Well, the odd exception, such as sending all animals to space, but no small, accessible solutions that individuals felt they could take part in were mentioned. We want this to change. We want young people to be able to feel they are part of a positive change that will help reduce their anxiety. They also need to feel that they have a plan and are prepared for how to deal with the impacts of climate change on their health. For this, we need your help. We need your help in preparing and empowering young people. Thank you.
We also had guests from the RCPCH Climate Change Working Group pop in to see us in our virtual podcast studio. They are a group of paediatricians who the RCPCH Us Climate Changers project links to. This is what we talked about with them.
My name is Shunmay, and I am also based in London. I am a consultant paediatrician and I specialise in infectious disease. I work at St Mary's Hospital.
Hi, I'm Katy. I'm a paediatric registrar up in Leeds, mainly working in the emergency department. And thank you so much for inviting us onto the podcast today.
Do you think other paediatricians, either locally or globally, are doing similar things to you?
So the UK, it's the first national health service to have a kind of net zero goal. And I think that's quite interesting. And I think paediatricians are one of the group of doctors who seem to be particularly active, I think, in terms of thinking about climate change and sustainability. And so when you talk to paediatricians, something that they feel quite strongly about, and I think they would be like to be doing more. Often we're doing things in our personal life. So you'll hear kind of paediatricians thinking about, what, their diet, so are they doing something about how they eat, how they travel, lots of us cycle. But then how do we carry this through to our working life is a bit more of a challenge. And that's, I think, something that's like being active in the RCPCH kind of climate change working group is a really nice way of us actually kind of trying to do something about that in our work. Or actually in our hospitals. So, for example, I'm working with a junior paediatrician in my department at the moment, and we're trying to do an audit of bins and seeing what are we doing right and wrong in terms of using the bins. Are we chucking things in the recycling bin that shouldn't be recycled, which then means that the whole recycling bin can't be recycled stuff in the recycling bins. I think people are trying to be active in the best way they can.
Was there one moment where you decided to do things on climate and health, or was there a number of factors that influenced it?
So for me, there was no set moment. It's been snowball effect. And I remember going down to the bottle bank with my mum and really loving to put the bottles in the recycling, and her explaining why that was important to me. She's a scientist, so that may be why even 30 years ago, I knew about these things. And as I grew up, like, my happy place is being outside and in the countryside. So preservation of that was really important to me. And then as I became a doctor, I started to realise that actually this was an ever increasing problem. And the commitment from the NHS, coupled with the college asking for people who were interested in this, really kind of made my snowball massive. And now this kind of forms a huge part of who I am as a clinician, as well as who I am as a person.
So on the background of this kind of growing personal concern, I used to actually be able to join the two things up. What I was doing in my personal life and in my work in terms of as a doctor and as researcher. So although I'm a paediatrician, my main hat is as I'm a professor of actually pediatric infectious disease and global health. And it's like, how do I join those things up? And so I spoke to one of my colleagues at work. So I work at the London School of Hygiene and Tropical Medicine, who is the director of the Centre of Planetary Health, and said, look, I'm really interested in kind of getting involved a bit more in kind of climate change and health research, and how do I do it? And he just happened to get some funding for a really interesting project called, I'm going to get the order wrong now, Children's Cities and Climate Change, and they were looking to get some more paediatricians involved. And so I managed to get involved in that, and that represented for me a kind of a step change in terms of actually being able to get involved in a research project, big online survey of children across the world, children and young people, in terms of how they viewed their cities and what their concerns were and what their aspirations were for their cities, and then getting involved in the RCPCH working group.
Okay, so hi, my name is Anokyewaa from Ghana, and I'm a plastic advocate. I do that in schools and in churches and in my community for the ban of single-use plastics. And my question to you, Katy, is what are you medical professionals want us to know concerning climate change?
That's such a big question. What do I want you to know? I think the thing I most want you to know is that doctors and people who are older than you care about this passionately, and that we are really, really keen to work alongside you and to listen to you, but also believe in the potential for the world to be an even better place if we're all engaging it together.
Actually, surprisingly, I think I completely agree, Katy. You and your colleagues spoke at the Royal College of Paediatrics Conference earlier, so last year. One of the most powerful things he said is that is you told us as paediatricians that we had power, and even if we don't feel like we have power. And I thought that was that we had a duty, and I think we do, to do what we can. And I told colleague what you had told us, and she spoke to her colleagues at the Harvard Business School. The fact that we, as adults and as doctors and pediatricians, want to work with you and listen to you, and kind of we're all in this together. You guys knowing that is really important.
All right, thank you so much, Katy and Shunmay.
Hi, I'm Noor. I'm 16 and I'm from London, and I'm part of the climate change group. So my question is, how can we keep motivating and inspiring people to focus on the impact of climate change and child health in general in challenging times when it may not really be the focus?
These questions are really fantastic, though, guys. So thank you.
Yeah, they're quite challenging. It's really challenging times, and there's so many other priorities. We can feel quite powerless and like we can't do anything. And I think if everyone does something small, then en masse, it makes a massive difference. And it probably makes more difference than just a couple of people doing loads. So I think there's real power in actually thinking of us as a community, all doing a little bit, and actually feeling, I think being connected with other people who actually are trying to do something and do their little bit is really how we can feel like we can make an impact. I can't change the world as an individual, but actually if I'm joining hands with the people around me and they're joining hands with the people around them to make a little bit of difference, we can do a lot.
I think it's about celebrating small successes. I follow somebody on Twitter that's called the Good News Climate Changer or something, and they refuse to post any negativity. They only post good news stories, and they can be really small, and sometimes they're really amazing successes. But I think it's about reflecting on ourselves as well. So I'm a real advocate in kind of positive mental attitude, and every time I remember to put something in a recycling bin and that I've thought about which bit of my bin it needs to go in, I give myself a little tap on the back. And I think when I hear people having done, so just in the staff room at work the other day, I literally said to the nurse, thanks so much for putting that in the recycling bin, because she'd bothered to wash up her yogurt pot and then put it in the right bin. And I just think rather than dwelling on what's going wrong or where the struggle still might lie, it's about dwelling on the success.
So I'd love to find more opportunities to actually be able to kind of engage with young people, and just sometimes struggle with thinking what's the best way of doing it. So yeah, that's my kind of question, I guess.
I definitely think it is something that even us as a group actually sort of think about sometimes and struggle with, because we always think, how can we sort of talk to doctors and get both sides? But I can't remember which group it was now, because I'm involved in about 3. I think I might have wanted to think of a way to communicate to doctors, for the doctors to communicate to their patients that they can also get involved in our group. But I think honestly the conferences are like our best way of communicating. Where was it? I think it was Liverpool. But we got to talk to all the doctors about climate change and ask them really interesting questions, and then make notes about it and sort of reflect on it. But the fact that it was in person, and we got to sort of take control and ask the doctors the questions, I think really it was really good. It was really useful. So I definitely think the conferences, but also meetings like this, I think are really beneficial as well.
I have to agree with Noor. I think conferences and meetings like this definitely. So I think if you're like exposed to things in conferences, then that's where it's gonna be like where you're gonna get the most exposure.
Maybe if you're sort of face to face, you could just spring it on them. So if you're talking about something after they're finished, just sort of ask them, or how could we maybe communicate better with young people, or just bring it up out of nowhere, because then people will be talking off the top of their minds. They won't have overthought it too much. They'll just say what they want to and say what they'll think.
I think it's very interesting for me what Noor mentioned, that actually it's a two-way street. So it sounds like we'd really love to speak to young people, and young people would really love to speak to doctors. So we must think both sides a bit harder about how we have that communication and conversation outside of our clinic room. I do think, guys, doctors do want to hear from you as people, not just as patients. I'm going to email Camilla Kingdom and ask for her thoughts too, because I think that's just a really, really interesting dilemma that Noor just brought up. That's really food for my thoughts.
Thank you so much for coming. It's been really, really interesting to hear your opinions and views on everything. So thank you so much.
It's an absolute pleasure. Thank you. It's been such a privilege to talk to you all. Thank you so much.
Yeah, same here. Yeah, thanks very much for giving up your evening for this.
Yeah.
I was going to say, really eye-opening to see that even though people across the world can still have such similar experiences, and just to hear their point of view.
Probably success, because even though we've had all the sort of tech issues, it's gone quite well.
I say interesting, just finding out that everyone's kind of having the same experience and things like that, and how everyone feels about this one issue that the whole world is facing.
Hi, I'm Aisling, and I'm a member of the Climate Changers project. We wanted to know what do other paediatricians and allied health professionals think about climate change. We had the chance to interview some at the RCPCH Conference in Liverpool, and this is what they had said.
The RCPCH declared a climate emergency, I think it was in 2019, and have developed a, we call it CCYG, Climate Change Working Group. From then, and we have, I think, about 5 different work streams from this. I suppose they're kind of task and finish groups looking at different aspects of what we can do in our college to address the climate emergency. There is one wing looking at the college itself and the building and the conferences we run and how to make them carbon neutral as possible. There's one wing which is looking at research, putting that together. There's one international work stream, there's one advocacy work stream, and then the one that I'm chairing is member support. We have developed a resource online for paediatricians and child health professionals and trainees with resources to help people know how to practice in an environmentally sustainable way and to support young people as well. I suppose kind of really pushing education side of it so that people are aware of this climate crisis and the impact on children's health and their future.
And I think that kind of enthusiasm and kind of passion that young people bring, and just brand new fresh ideas, things that new ways of thinking or new technologies that we might not have thought about, or kind of digital ways of working that reduce our waste and our impact. I think it's very easy, particularly in an institution like the NHS, which has been doing things a certain way for as long as anyone can remember, and change is incredibly slow. I think often to have that kind of passion and excitement and energy to actually drive things and drive ideas and is something that we really need.
And I guess the young people that we come across in the hospitals, they are the group of young people that know what's happening in the NHS, so they have a better idea of what we do, and they will certainly have more ideas on how we can change things.
Yeah. I think asking those questions, isn't it? If you're in hospital and you're like, why do you do that way? You know, I've seen those bins emptied 6 times today. Why is there so much waste? Is there other ways of doing it? Those things that we don't see because we're doing it every day and don't necessarily take note of.
It's a blind spot for us, isn't it?
Yeah, it's a blind spot. Yeah.
I don't know how good we are actually bringing up that, because it's not be directly relevant to why they're there or their care or what we're doing that day. What do you think? Do you think young people would like to bring it up more?
I think definitely. I think it mostly affects young people, you know, especially as with healthcare, you know, asthma and stuff, that's directly affecting them. So I think it's definitely a discussion that should be had, and like it should be a collaborative process to try and figure out where we can go to like make things better.
What do you think an 8-year-old would say about climate change in health services?
Probably, Demi, to answer your question, I might narrow it down a little bit, if I may, to a child that's got asthma.
Yeah.
And think about them questioning me about, well, how can you help me if I live on a main road and there's a lot of traffic and there's air pollution, or I live next to a motorway, what can you do? And then it would be up to me to contact the various partners like transport and local authority and ask them, do you measure air pollution? What are you doing about traffic calming? So I suppose I'm just picking and trying to put it in a context of a clinical problem that I might get in clinic, and then what could I do about it? And even if I didn't know who to contact, I would find out how to signpost, who to put me in the right direction to get that information. And use that story, because that story might be very important for the local counsellor as well.
I think that's all of our questions. Thank you for having this interview.
Could you tell us like what you think about climate change, how it's affecting like healthcare for children?
I don't think I know at the moment what the impact of climate change is on child health at this minute, but I'm alarmed that we probably need to act now so that in 20 years when we see the impacts, we've started to make some change.
So do you think that children can work to help with that, and how will they do that?
I don't have a good grasp on how it's going to affect health. My interest is in global health, so that's obviously, it's a bit more obvious how it's affecting children in the developing world. I don't know how it's impacting children in the UK yet, but I'm interested in the fact that a lot of the patients that we see seem to know a lot more about climate change and much more proactive than I think we are. So it's very interesting speaking to them and their questions about masks and gloves and apron, very kind of in the moment. They seem to be asking those questions.
What do you think an 8-year-old would say about climate change if you was to ask them?
I'll give you my take, and I think Anastasia might have a take from probably asking her own kids this question. I think an 8-year-old could and should and would say, adults, what on earth are you doing about this, and why haven't you done something already? And I think that's the right question to ask. I don't know what your kids have probably got a good answer
I do
for
have
this.
children in that age range. I think what's great about them is that they challenge, so they, from a very early age, this has been a topic. Whether it's about the type of car we have or what we buy in the supermarkets, and even as a doctor, what are we doing to reduce the impact on the earth? So they seem to be really well informed, I think, and are making the right decisions.
And do you think that young people with like long-term health conditions worry more about climate change?
I imagine the answer is probably yes, because I think probably if I was a child with asthma, I would be probably more worried about the impact of particulate pollution and the use of cars. I think that would be the right questions to ask. I think it's such a universal problem that I think probably the bigger concept of climate change is probably just as applicable to children who are healthy as children who have long-term medical conditions as it is to their parents and their grandparents and the other generations.
I agree with that. I think the one, children with chronic illness, they live so much in the moment that whatever symptoms they're experiencing, if they can attribute that, like pollution and respiratory illness, to climate change, that's a big concern for them.
Hello, I'm Joseph from the Podcasters Project. We're coming to the end of our podcast now, and it's time to see if you've worked out the climate change tips we've been sharing on Twitter or in the show notes. I wanted to find out a bit more about how we could all do something small that could make a difference, and did some research, and I found these tips. Charge your device to 85%, do 30-degree washing, avoid using your device while charging, and the old make, do and mend. We wanted to create a bit of an interactive part to our podcast, which is why I used a Caesar cipher code of 17 to code them. Hope you enjoyed working them out. There are 2 that I've left for you to decode on Twitter in the coming weeks. Thanks for listening.